Good morning. It is Wednesday, March 25th, and I'm happy to welcome you to our daily highlights during COVID-19. This is Dr. Stephanie Taylor, and I'd like to bring you the latest updates. So for the statistics on the global pandemic, the most up-to-date numbers you can get online from the World Health Organization. Overall, the number of infections are still on the rise. In some countries, the rate of acceleration is slowing down. So we don't really know how optimistic to be at this point. However, there are some things we can do. So what can we be hopeful about? So just looking in general, how does medicine deal with disease? How does medicine deal with infections? Well, in the case of COVID-19, our strategy is to try to increase the protection for each human being. So we do this through either increasing a person's immunity. This is done primarily with vaccinations, where we essentially trick our immune system into thinking that we've had the infection. We trick our immune system into thinking that we've had the infection, and therefore we already have immunological memory, and we can more effectively fight an invading virus, in this case, the SARS-CoV-2. Another strategy clearly is, when we get sick, to have treatment so that we decrease the destruction caused by the disease. In the case of a vaccination, there are labs working on this. The closest estimate that I can really find is that a widespread vaccination is at least 18 months away. So it is on the horizon, but it's sort of a distant horizon. What else can we do? So building professionals and people who talk about our environment are clearly emphasizing decreased exposure to this virus, which again is a very effective measure, and something that we should all be paying attention to. So social distancing, hand hygiene, cough etiquette. What else can we do in terms of the built environment? Well, in general, when we talk about the building and disease, we think about reducing exposure, reducing the toxicity of the building. So we do this through controlling surface materials, through controlling airborne contaminants. So this is all risk reduction. But there's another strategy that we can take with the indoor environment, and that is, how can we manage our buildings so that we actually have improved health, and in this case, improved immunity through exposure to the indoor environment? And once again, I'm excited to tell you that this comes down to managing our indoor water vapor, or relative humidity. We now know that from the research that was published in May of 2019 from Dr. Awasaki's lab at Yale, that when you maintain, her research was with mice, genetically engineered mice that have an immunological response, in this case to influenza, is similar to humans. But her findings, and those of her postdocs and the rest of her lab, showed that when the indoor air is maintained at 50% relative humidity, the genetically engineered mice were able to have a better and more robust immunological response to the viruses. So this manifested itself in several ways. Comparing low relative humidity of 20%, which is what most of our buildings would naturally fall to in the winter. We have cold air, we bring it in, heat it up, air becomes dry. However, if you humidify that air to 50%, you will have a better response to, your immune system will be more robust. So again, in her research, she found that at 20% relative humidity in the dry conditions, the mucus in the airways of the mammals was more viscous. Therefore, the cilia, the little hairs that are protective in clearing particles away from your lungs, were less effective at moving things upward. She also found that that other steps of your innate immunity, your original immune protection response, were impaired in dry air. However, at 50% relative humidity, the mice had a more robust and healthier immune system. They lived longer. They didn't lose weight, which preceded their death, as rapidly. And overall, they survived much better. So again, we are not genetically engineered mice. However, as human beings, instead of only waiting for medicine, for physicians, nurses, and other clinicians and scientists to develop an effective vaccine, while we're indoors, why don't we actually manage our environment to improve our health? What we can do now is increase the humidity in our indoor environment. So humidify your homes. If you're still going to your offices, humidify your office. Buy or make a hygrometer so you can actually monitor your levels, so you know if you're under 40% or over 60, which is unlikely in a wintertime climate. Can you rely on your skin to tell you what the relative humidity is? No. We don't have sensors for dryness, so you cannot tell just from some innate neural sensor in your skin what the humidity is. So it's really important that you monitor this and manage it. And in a cold winter environment, you're going to most likely need added humidity. So that's the really good news, because this is an actionable event. So as the statistics continue to be alarming and we wait for medicine to help us with vaccines and with better treatments, we can manage our built environment. The other good thing about this is that a healthy humidity range is not only effective against COVID-19, it helps us maintain our health all year round. So I encourage you to take action, and I'll see you tomorrow.